Assemblywoman Munoz, I would love to welcome you. Welcome to the Significantly Invisible podcast. I'm
Oh,
your host, Rosie Takar. Today, I'm
thank you
honored
so
to
much for having
welcome. Thank you, Ms. Munoz.
me.
Today, I'm honored to welcome Nancy Munoz, Assemblywoman representing New Jersey's 21st Legislative District, which actually includes parts of Middlesex, Morris, Somerset, and Union counties. Assemblywoman Munoz has served in the New Jersey Assembly since 2009 and currently holds the role of Republican Budget Officer. Over the years, she has also served as Deputy Minority Leader, Conference Leader, and Republican Whip, bringing deep institutional knowledge and leadership experience to the legislature. What makes Assemblywoman Munoz's perspective especially compelling is her more than 35 years career in nursing. She has worked in some of the nation's most respected hospitals. Her frontline experience in surgical intensive care informs her reputation as one of the legislature's most knowledgeable voices on healthcare policy. She holds bachelor's degree in nursing and master's degree from Hunter College as clinical nurse specialist. In addition to her legislative and clinical work, she's a mother of five and has long been deeply involved in education and community service, including leadership roles in the Summit PTA and service to early childhood programs supporting low income families. Assemblywoman Munoz currently serves on several key committees, including budget, health, joint budget oversight, and multiple commissions forced on health benefits, hospital services, child welfare, and state planning. Today's conversations bring together healthcare, policy budgeting, and lived experiences, exactly the kind of leadership that often operates behind the scenes yet shapes outcomes of millions. Assemblywoman Nancy Munoz, welcome to the Significantly Invisible podcast.
Thank you so much for having me. It's a real pleasure to be here today. And Happy New Year.
Oh, Happy New Year to you too. I'm very excited. You are my first guest for this new year. So we're starting it at a high note.
Oh, thank you.
You have served in the New Jersey Assembly since 2009. What personally pulled you from healthcare into public service, and what has kept you going for so many years?
Well, I am a nurse by profession, and my husband was a surgeon who was in the legislature. He served from 2001 until his untimely death in 2009. And he understood, and we understood together, the importance that state legislatures and state policy and law affects the impact of healthcare delivery. So, we talked a lot. We were, very much committed to each other and to our professions. And he woke up on March 30th of 2009. He said something was wrong. And unfortunately, he had dissected his aorta, and he died in the operating room at University Hospital in Newark several hours later at 5:30 that afternoon. He was a practicing trauma surgeon at the time, actively working as a trauma surgeon. Had just worked 36 hours a shift for 48 hours before his death. He was a full professor of surgery at the medical school. He was an administrator at the medical school, and certainly understood healthcare delivery. And we shared that commitment to making sure that we have the best access to healthcare by making sure that we can practice healthcare policy in the state of New Jersey effectively.
Mm-hmm. And when you think back to your first year in Trenton, what reality of governing surprised you the most? Like, what was very different from what you might have expected the work process look like?
I'm a Republican, so I'm a member of the minority party. The Republicans have not been in the majority since 2001. So being in the minority party, there's challenges that you have to face. And most important challenge is making sure that the legislation that you author and that you advocate for is supported by the majority party. So that, I think one of the first thing that surprised me in that first year was um, the impact of that had on me. In other words, that I wasn't actually able to get through policies that I thought were critically important. And some of those
Mhm.
policies I've been working on for the entire 16 and a half years that I've been in the legislature.
Mhm.
The Speaker of the General Assembly impacts what bills are heard. The Senate President impacts what bills are heard in the Senate and which bills are voted on. So, if unless you have a collaborative work relationship with somebody from the majority party, oftentimes things that are really important don't get through the legislature.
Mhm. That's very interesting because people who are not involved in Trenton might think that there are certain things that are bothering the grassroots level, and people in assembly, people in Senate are really not being aggressive about those topics. But as you just explained, there is a process, and that anything that you really want to do doesn't necessarily actually the outcome goes in your favor. Totally understandable now. Now,
And
you
the
were a
only,
registered
if I could,
nurse.
just
Yeah.
so as I could, is well, oftentimes really good piece of legislation, which I have authored, gets picked up by the majority party. And they all you have to do is change a few words in the piece of legislation, it becomes their legislation. So sometimes I'm
Hmm.
kind of I know you could argue that it's a good thing that at least it's going through. However, on the other hand, there's legislation that's going through. I'm like, well, that was my legislation. And to your point, our constituents may think that we are not, the members of the minority party are not working really, really hard. So I can give you two quick examples. I have an example. I came up with the idea to have a certain percentage of the cigarette tax go to smoking cessation programs. I authored that bill. It was picked up by a member of the majority party. I advocated a certain percentage. He advocated a much higher percentage of the cigarette tax. He changed the bill to be the same as mine, and it became his piece of legislation. It was my idea. So I am glad that we are working towards smoking cessation programs in the state of New Jersey. However, that was it was like, it's sort of not a slap in the face, but you realize that sometimes good ideas are stolen by others. There was another piece of legislation that I worked on that I read about something in the New York Times, and I put through a piece of legislation, making sure that people whose homes go into foreclosure, that the money that they've invested in that home goes back to them and not goes to the bank. So in other words, you're foreclosed on a home because you can't afford it, but you've invested perhaps 100,000 or whatever the number is, and that money should go to you. And it went through the legislature and it was passed. It was credited to a legislator who had not even been elected to the assembly when
Wow.
I introduced it. And so, you're baffled by that, and because you realize that you're doing really good work.
Mm-hmm.
And obviously the other side is also watching your good work. Again, the ultimate outcome is you have good legislation. On the other hand, my 250,000 constituents in District 21, they may say to themselves, well, what have you done? Well, we've done a lot. And,
Yes.
I have done a tremendous amount, and that I have to be proud of. So.
Believe it or not, these are the questions. So I think in every election cycle, whenever we sit down with ladies' luncheons or we moms get together, or even when we're waiting at the bus stop to pick up our kids or drop off the kids, these are the conversations that happen even at kitchen table with your families or on bus stops. We randomly talk about things, and these are the conversations that need to be highlighted as well, because for parents, for grassroots level moms, or even educators or students themselves, we sometimes feel like we're hurting here. We really need someone to step up. We have leaders that we supported, and when they were getting elected, when they are finally elected, it's really, we're not seeing that momentum, we're not seeing that passion anymore. But thank you for explaining that. No, that passion always is, and that's why you ran and that's why you're there. But it's not always easy. Your ideas are stolen. And I think that's at every industry or every age level. your ideas do get stolen. So, yes, thank you for
Yeah.
clarifying that. I appreciate you.
Well, thank you.
Yes.
And like I said, as a state legislator, I read the newspapers every single day, and that's it, it it's a reminder of the issues that are important to the people, and based on those reading that information, having access to what is concerning to the public via the newspaper or through actual contact. They come to the office with issues, and we work on them. And
Mm,
I don't know if we're going to discuss some of my pieces of legislation, but when we do, when it comes to the banning underage marriage bill, we can talk directly about how one constituent directly had an impact on this and how fiercely I fought to get this passed and become only the second state in the nation to pass this legislation into law.
let's elaborate on that a little bit, if
Okay.
you would please.
Yeah, well, it was a woman who was she's the head of Unchained at Last, and she came to my office while Chris Christie was still the governor, and she was very concerned about arranged marriages for underage individuals, mostly females, and in some cases males. But it was always, if you're underage, you're a child, and
Mm,
it's many times for religious reasons, and other times it's for in order for immigration status reasons. And we were seeing that there were young girls. I'll focus on the young girls being forced into arranged marriages, and we, as a public, we tend to think like this isn't happening. But if you go before a judge and a judge gives permission, then it happens. So this
mm,
woman came to me, and she was very, very. She had been a person who was in an arranged marriage that she's a woman of the Jewish faith, Orthodox Jewish faith, and she was very unhappy. And it's very difficult to get divorced in many cases when you're in these kind of strong religious groups. So she was
mhm,
a very fierce advocate for banning underage marriage. The first thing I did was go and get a Democratic co-sponsor. Reed Gusiora, who's now the mayor of Trenton. He was a person I could always turn to because we were very like-minded on many things. Got him as a second co-sponsor. Then we lined up numerous people to be co-sponsors. When people began to realize that there were young girls who were going as young as 15, who were being forced to marry men as old as 35 in order
wow.
for immigration status or for religious reasons, people were indignant, and my colleagues in the legislature supported this. We passed through both the Assembly and the Senate during the Christie administration, and unfortunately, Governor Christie vetoed the bill. I
Mm,
wasn't deterred. That was he. Governor Murphy was sworn in the following year. I reintroduced the legislation. I again got each new session you have to get new sponsors, etc. I asked Assemblyman Gusior to be on the bill again. We got it through both the Senate and the Assembly, and Governor Murphy signed it into law. And we had been the first state in the nation to ban underage marriages. We became the second state because Delaware got it done in that interim period. But I feel really proud of that because went to an event in New York City which was about this topic, and there was a young girl from she wasn't a young girl any longer, but a mother and her daughter from Florida, and the age difference between the two of them were 10 years. 10 years.
wow.
Young girl, the mother had been raped when she was 9.5 and forced to marry the rapist. And the mother was 52 and her daughter was 42. And it was her mother forced her into this marriage because she didn't want the person who did this to her daughter to go to jail. Well, who
Mm,
was the real victim here was the child. And so
yep.
we in the state of New Jersey have prevented that from happening, and for which that is something that I'm extraordinarily proud of. It's protecting children, protecting women, protecting people. As a nurse, my job has always been to
Mm,
be an advocate for a person during their most vulnerable and difficult times. That's what I've always done. Why I became a nurse. That's what I did as a nurse. And I've taken that same principles, those same strong motivations into the legislature. And when I see something that needs to be done, I do it. And, sometimes you have to fight for 15, 16 years to get it done. And
wow.
even then it doesn't get done. But, I always feel like I'm doing it for the right reason.
Yes. Yes. And we all really truly appreciate you on that. You've created a legacy and you've earned that respect for the right reasons, that you worked hard for years and years to just get the things done the right way. Now, when you were a registered nurse before entering politics and have been a strong advocate for the nursing profession, looking back, what policies or initiatives do you think have been the most meaningful for you in terms of supporting nurses?
Well, I went to Skidmore College, and got a Bachelor of Science in Nursing. My mother was a U.S. Cadet Corps nurse. That's why that poster is behind us. Which it was during World War II when the nurses went over to Europe. We had a
Hmm.
tremendous shortage of nurses in the United States, and my mother was a U.S. Cadet Corps nurse. She became a nurse, and she was my role model. And she worked at Yale New Haven, as did I. And when she was working there, she said she worked with one nurse that she thought was an excellent nurse, and the nurse went to Skidmore College, and that is why I went there. And I'm a very strong advocate that the nursing profession should have a Bachelor of Science in Nursing.
Hmm.
We still, since 1960, it was advocated in 1964 by the American Nurses Association that all nurses should have a Bachelor of Science of Nursing, all professional nurses.
Okay.
There's people who don't agree with me about that, and I understand that. In that regard, though, I'm also an advanced practice nurse. I got my degree as one. I'm not certified in the state of New Jersey, so I can't practice as an advanced practice nurse. However, my master's in nursing was as an advanced practice nurse, and my strongest, most ardent advocacy in the legislature has been to allow the advanced practice nurses to practice to the full extent of their license. All advanced practice nurses are nurse practitioners. They are
Hmm.
certified registered nurse anesthetists. They are nurse midwives, and they are clinical nurse specialists in psych. They all have certification, national certification. They all do extensive continuing education. In addition to their RN license, which we all do continuing education, the advanced practice nurses have to do an additional 25 hours of pharmacological in-service every
Hmm.
5 years, which is unique to. I have two sons who are doctors, a daughter-in-law. 7 members of my family are physicians. This is unique to advanced practice nurses. In the state of New Jersey, in 1991, we signed into practice. The advanced practice nurses have full practice authority with the exception of prescriptive authority. And what I mean by that is this: they may write prescriptions, but they have to sign a contract with an MD or a DO and
Hmm.
sign a contract for prescriptive authority only. And they only have
Hmm.
to do a review of one medical record per year over the phone. That is it. They're not asking for permission to write prescriptions. So I am advocating through my legislation to release the tether, because these nurses are paying for the privilege to practice nursing. If you're
Hmm.
in private practice and solo practice, unless you're married to a doctor or related to a doctor, they charge the nurses. The nurses are paying between $500 to $1,000 per month for the privilege of writing prescriptions. Now, the majority of these advanced practice nurses who are paying this fees are mental health providers who are
Yes.
taking care of Medicaid patients. And so release the tether. We release, we by and everything else, diagnosing, referring, uh, everything else is they're allowed to do. But the prescription pad has the name of the physician at the top
Hmm.
and the name of the advanced practice nurse below. That what that means is we have a delay in care. If there's a problem with a mammogram, they don't call the advanced practice nurse, they call the physician whose name's at the top of the prescription pad. And that physician may never have met that patient ever. But so we have a problem with a prescription. We have a question about a prescription. There's a delay. There's no need for this. So during COVID in March of 2020, when we were entering into our COVID crisis,
Hmm.
I recommended and we did remove this requirement for this for the joint protocol in March of 2020, April of 2020 by executive order. It is that executive order is still in effect, which means that it'll be almost 6 years that the
Wow.
nurse practitioners, the advanced practice nurses, have practiced without this the requirement of the joint protocol. So there are people who say, Well, let's have a trial program. Well, we just did. We just had a
Mhm.
6-year trial program. And
We
you know
did.
what? There's been zero complaints to the Board of Nursing
Mhm.
because, my husband was a surgeon, as I said. He
Mhm.
said he was well aware of this. And he said, what are they afraid of? There are enough patients to go around.
Yes.
The young
Yes.
doctors, of which I have 2 young doctors and a daughter-in-law, they know that they need more healthcare providers who are able to practice untethered. They're not
Mhm.
going to be doing they're not going to be doing spine surgery. They're not going to be doing neurosurgery. They are not going to be doing anything that they're not trained for. And it's time for us to undo this tether. And the
Yes.
other thing that's significant to note is 28 states and the District of Columbia have removed this restriction. And those states include Massachusetts, Connecticut, New York, Pennsylvania, Maryland, Delaware, District of Columbia. Where do we think as a state that the nurses who get their advanced practice degrees are going to go practice, if not to those other states? We're a small
Mhm.
geographic area. And, like I said, the majority of them who are really affected by this
Mhm.
are, in solo practice providing mental health services. The
Mhm.
other people who are in the hospitals, we are paying through the healthcare system for
Mhm.
a hospitalist, for a physician. That we looked it up. We did some research. They're getting paid an extra $107,000 a year just to
Mhm.
be the signator for this practice. This would we would save healthcare system billions of dollars while
Billions of
also
dollars.
allowing advanced practice nurses to practice for which they are educated,
Yes.
certified, and
Mhm.
qualified. This
Yes.
is purely a competency based certification, and they're
Mhm.
capable of doing it. My oldest son is an orthopedic spine surgeon. He could not manage mental health, psychotropic drugs because that's not what he's trained in. But he would be
Mhm.
allowed
Mhm.
to earn money just by to be the signator on this. This needs to go away. It's time for us to modernize ourselves. I had a gym teacher in high school who said, "Modernize yourself, girls. Modernize. We need to modernize healthcare, and we understand we need more providers. We have them available. Let them practice."
Yes, our healthcare system is one of the many systems that are broken in New Jersey. New Jersey needs to really wake up and, pull together in a lot of different fields. Healthcare is absolutely amazing. As you're fully aware, my husband had the stroke this
Yeah.
in 2025, and he went through the entire surgery and everything. We were in Overlook Hospital. The first thing that I was told when we were moved from Chilton to Overlook Hospital is, "You're here on a weekend. There's only one doctor, and he's on 3 calls, and he's in the town over. He will be able to come here and operate on your husband if and when he gets a chance." So it blew my mind that I'm standing in one of the most prestigious hospitals in New Jersey. In fact, in our nation, Overlook Hospital is really one of the best. But this is what I was hearing. There was shortage of people working. There were no staff, not enough staff, and nurses. And again, I truly believe that the reason my husband is alive today is the kind of care he got from all the nurses. They were around all the time. They were helping me understand what's going on, because for me, it was like life and death. It was like my whole world was crumbling in front of my eyes. So they didn't just do the work of medical work. They were there as my supporters. They were there calling in the nutritionist all the time. They were helping me when the cardiologist was coming. So they were there round the clock. And I would say they were doing work of God, helping. And today my husband is alive
Yeah.
thanks to all of them.
And
So
I would say that,
definitely a
yeah. And,
huge.
an academic center is, like the academic centers, the Rutgers, University Hospital, Robert Wood Johnson, the programs that have strong academic training programs, that's where we tend to get our best care. And the reason is that we may not have the attending surgeon, but what we do have is the resident surgeons. So my fifth son, my fifth child, my youngest child, I don't have four, I have four boys and a girl, but my youngest child is in training. He's in his 5th year of training at university. And I would argue that it's, the attending surgeons, for the most part, except for trauma and anesthesia, go home at night because they should. But it's
Yeah.
the residents who are actually running the hospitals. And I'm a very strong advocate for University Hospital and other academic centers because, those residents we passed legislation a number of years ago when my husband was still alive that they could only work 80 hours per week. But there's a qualifier there. It's 80 hours per week on average over the month. What does that mean? That means that one week you work 40 hours and another week you could work 120 hours. So that it averages out to 80 per week over the course of a month. But they're getting paid, the Rutgers residents are getting paid $18 an hour to $20 an hour, which is less than the cleaning help down in Atlantic City. I have argued for increased pay. And just so you know, and people should know this, this federal government, through the Medicare program, pays the residents of all the training programs across the nation. Each training program receives $180,000 per resident, and then the training program itself determines what the salary is. So, that's why, and we now know that these younger doctors are going to choose to go to other places where they can they can make more money. I mean, when you think about it, a neurosurgery resident, this is apropos to your life, is a 9-year training program. It's 7 years of neurosurgery followed by 2 years of fellowship. So we're talking about somebody who's in their 9th year, and I have all the stats. They're making $22 an hour.
Yeah.
$22 an hour.
Yeah.
And, your husband's life and the life of many others is in their hands. So, that needs to be looked at as well. As a budget officer, every year I pushed, the president of Rutgers University to take a look at this. Why are they paying so little? Because what it does is it makes it harder to attract the top graduates of the medical schools. So some of the slots don't get filled if you can't provide enough, because a lot of these residents, many of them, have student loans that you have to start paying back once you become a resident. So you're paying back student loans, you're making $18 an hour, you're running the hospital at night from like 7 o'clock till 7 p.m. to 7 a.m. That's it. I think that we as a nation need to look at that. And people go, well, they're going to make it up at the other end. But that may be true, but we have to also look at how are each individual training program paying their physicians to be trained so that we can attract the best best graduates of our U.S. medical schools.
Absolutely. And nursing is not the only piece where you've worked. You've worked on legislation related to child protection and domestic violence as well. So what have those experiences taught you about where system tends to fail families first, if you can break down the most commonly occurring ones for us?
Well, the most current, so I have been appointed to the Task Force on Child Abuse and Neglect. It was been certainly more than 8 years, because I was there during the Christie administration, so probably 10 years. And there's a liaison. It's a bipartisan, bicameral liaison from the legislature to the task force. I will give myself a pat on the back that I, for the most part, was the only legislator who actually attended every single meeting. If not myself, then my office, if in the event that I had something else that I had to attend. And one of the things that came to my attention as a result of this was approximately 2 years ago, and I think I was in California. I had one grandson who was not well, and I was out there and I was listening, but I was still on the task force. We did it virtually, and I heard that there was an issue with child-on-child sexual assault, and that 37% of all child sexual assaults in the state of New Jersey are child on child. What does that mean? That means that either an older child is, having inappropriate sexual contact with a sibling or with somebody else. And, I heard this, and nothing else was said of it. So I called Dr. Martin Finkel, who at the time was the head of the physician, the pediatrician, and head of SOARS, and I forget what it stands for, but it's the group that takes care of these children who are victims. And now the new he retired, and the newest liaison is Dr. Rachel Silliman Cohen. And I've worked with both of them. I called them up, and I found that there was a gap in the services that were being provided by the Division of Children and Families by the state of New Jersey, by Human Services, not Human Services, Children and Families. And so I put their feet to the fire, and I said, "What are you doing?" And there was not at that point, so it was about 2 years ago, anything being done. And the commissioner was quite angry with me that she said, "Well, that's not my job." I said, "Well, then what is your job?" And it's all on public record, so I can say it. A year later, something had been done. And when Dr. Silliman Cohen, I think it's Silliman Cohen, heard that I was not returning to the legislature, she said it's a great loss because she and Dr. Martin Finkel worked on this issue together and made sure that the state is addressing this. Under the age of 12, it's usually just curiosity. Between the ages of 12 and a minor is considered up to 18, it's more that it's an exposure to things, whether as hard as a parent tries. And I give parents, all the credit in the world in raising children these days with social media. Kids get on the school bus, you have a phone, things pop up on the bus, on the screen of the thing. So we need to do more. We need to be able to say to the parents who are calling in desperation, "I need help. My older sibling is sexually, having inappropriate sexual contact with a younger sibling, etc." And because of this work, the state did something, and now we know that there's a process in place. And I'm extraordinarily proud of that, for having done that. I was also appointed to the Ad hoc Committee on Domestic Violence by Chief Justice Stuart Rabner. That was back in 2015. This is the result of, some things that were happening. I think it was a direct result of the Katie Brennan case, I think, but it may not have been. But with that case, which was during the Murphy run for election. But, as a result of that, I was one of the, again, 4 bipartisan, bicameral appointees. It was Senator Diane Allen and Senator Loretta Weinberg, and Troy Singleton, who's now a senator, was the assemblyman, and myself. And the 4 of us were appointed, along with law enforcement across the state, all the groups that were advocates, the Coalition to End Domestic Violence, from judiciary to law enforcement. And we worked and were able to identify areas that needed to change to actually help the victims. And part of that was education for the municipal prosecutors and education for the municipal judges, so that they would have policies in place to protect the victims of domestic violence. That was also very difficult legislation to get through, despite the fact that we had 4 pretty powerful legislators who were pushing for it. Mainly because it was, believe it or not, professionals don't want to be told what to do. So my biggest pushback was from the lawyers in the legislature, who said that they didn't want to be forced to do in-service education on domestic violence. Reality is they have to do their continuing education anyway. So I have advocated for and put in legislation that all nurses should have to have part of their continuing education requirement education on domestic violence. Now, you could argue currently that they do have some, because I worked at Overlook Hospital, and I went to the break room, and there was a sheet of paper there, and it had the questions about domestic violence, and you had to do it, but it was very, very elementary, and it had already been filled out. So if a person comes to you and says she has a bruise, and she says she bruised it because she walked into the cabinet 2 weeks ago, but the color of her bruise isn't consistent, blah, blah, blah. That's not enough. That is not enough. And I personally took one of my continuing education courses on domestic violence. It was a 2-hour required course from the state of Florida. And I have advocated that the state of New Jersey modify that course, require it for all nurses, because who do victims of domestic violence see most I would argue it was the nurses. Whether they
Yes.
bring a child to a pediatrician's office, whether they
Mm,
themselves end up in the emergency room because they're a victim of domestic violence, whether they go, whatever it is, that and nurses are considered the most trusted profession. So I
yes.
think a more in-depth course on domestic violence should be required. Again, another piece of my legislation that has not been passed, but I feel very strongly.
Mm,
Our ads in this campaign were about our work, meaning mine and my running mate, Assemblywoman Matsakudis. We both worked with JBWS, which is the battered women's group that represents Morris County as well as Passaic County now. And
yeah.
as a result of our television ads, two
Yeah.
individuals called me up personally, contacted my office. I gave them my cell phone. They called me, and I was able to connect two women, victims of domestic violence, with a coalition to end domestic violence, because in both cases they weren't in either Morris or Passaic counties. But the coalition to end domestic violence was part of that. Was part of the group that worked on that ad hoc committee on domestic violence, and I'm very proud of that. I'm proud that I was an advocate for women,
Mm,
advocate for children,
mm,
advocate for access to health care. Those are
mm.
all things that I am extraordinarily proud of. And I think the hardest part about not being reelected is fearing that some of this legislation won't continue to be as fiercely advocated for as have been advocating for it.
Well, that fear is mutual. We feel the same way that next year there is going to be a void that is never going to be filled that quickly or that easily. The space that you had, and I don't think there's anybody who can take your space ever.
Thank you for
But at the
saying that.
same time, can you believe just from two counties alone, you got a personal phone call from 200 women? It just blows my mind to think
Not
how
200,
many
two, two.
202 calls, personal phone calls to you, just from two counties alone. New Jersey, statewide, there are many other women out there. I'm sure they are looking for help and need help. Can you just give a message to those kind of women who are looking for help, but in different counties where they just can't find someone to talk to? What message can you give them?
Absolutely. First of all, if you're being hurt, to make sure that you are not ashamed to reach, ask for help. Number one, and if you are injured, call 911. But there are groups. The major group that I have worked with is the Coalition to End Domestic Violence, and then every county has contacts for that. And what they do is that they link you with an advocate. Number one, to help you through the process. The advocate helps
Okay.
you with the legal process. The advocate helps you with the healthcare process. The advocate helps you find housing for you and your children, so that
Mm,
you, and if you, in the case if you have children, have a safe place to call home, that you could get a good night's sleep without fear. And this is what we have, this in all 21 counties in the state of New Jersey. And I have always counted on the Coalition to End Domestic Violence as a starting point. Nicole Morella, I've worked with her. She's amazing. And she and I have worked together on all kinds of legislation, on all kinds of policies. But I would say to everyone, reach out. There is a hotline. You can go online if you have to. And they're very mindful of they won't call you for fear that the person who's hurting you is waiting for that phone call.
mm,
They will communicate with you in a way to find the safest way for them to reach out to you.
mm,
And that's because they have years and years of experience. And so I have worked with that group for the 16 years that I have been in the legislature on different pieces of legislation that make a huge difference to protect the victims of domestic violence, to
mm.
protect the families, and make sure that they're safe. And worked with law enforcement on this regard, making sure that
Yes.
law enforcement knows, because they're the first line sometimes is the
Yes.
police officer being called. So also
Mm,
making part of our work in that task force, uh, ad hoc committee, was to work with law enforcement. How do they get to a home? How do they address the person who's
mm,
being victimized?
mm. Thank you so much for that hard work because clearly you have saved life not just by being a nurse or for the healthcare profession, but in other ways as well. Let's roll back a little and talk about the child protection we just spoke about. You touched upon there are most of the cases that you hear in New Jersey are child being the victim. And again, the person attacking is also a child. And you mentioned siblings. It could be kids playing same sports. It could be two boys or two siblings or two people on the same team. It could be competitive sports where they have to travel. Something happened with the child abuse. If a parent finds out, what is the process? Who do parents go to? Because a lot of times I'm sure parents might be hesitant, would be more careful about they are just trying to report their own two kids if they're siblings. And it could cause a huge disagreement if one parent is reporting for another child who's abusing their child. What is the first thing that those parents should do, and what message would you like to give to those parents?
You know, I would always tell people to speak to their pediatricians. The pediatricians shouldn't have be your first line of
Mm,
so for people, because the pediatricians should have education about this. The second
mm,
is to call the Division of Children and Families. Call
mm.
directly and ask for help. Again, the
Okay.
Task Force on Child Abuse and Neglect, which I worked with, we had, in order to have we had 25 or more people at every meeting, and they represented all different organizations across the state, whether
Mm,
it was a private group, a county group, and they would be the best person to show to point you in the direction of getting help. And I think that you've made a really, really important point, maybe not even realize that you made this important point, which is that the work that both Dr. Finkel and Dr. Silman Cohen and I did to force the Division of Children and Families to look at, is because we want to, if it's a child
mm,
on child, we
mm,
want to make sure that the child who's doing who we don't call them, we call them, there's a term, but I'll call them the actor, not the
mm,
victim, but the actor. We want to make sure that
mm,
they don't get classified as sex predators for the rest of their lives.
yes.
So there's actually two states in the
Yeah.
nation that have done a really good job. And off the top of my head, I can't, I could be making a mistake. I believe one of them is Kansas, and
Mm,
one of them may be Oklahoma, or I'm not sure. I don't quote me on that, but I had that in the top of my front of my head a year ago when I was talking about this. But the whole point is to get the actor help as
mm,
well as the victim.
yes.
Not, and that was the reason that people were reticent to report, because they were afraid that that child, for instance,
Mm,
would be labeled as a sex offender for
mm,
perpetuity. But
mm,
these two states that I mentioned had passed legislation, a very good legislation, which New Jersey, the two doctors I was talking with, would like to model New Jersey legislation after, was to make sure that that child, the actor, got
mm,
help as well as the victim, and to help
mm,
the parents navigate that. So there is the Task Force on Child Abuse and Neglect, and it's through the Division of Children and Families, and,
mm,
and the pediatricians in the state of New Jersey should be able to give information to those parents who need help with that, and not to be afraid to ask for the help, because
mm.
you want to help both. You want to help
You're
both the
right about that.
perpetrator, I call the actor and the victim, because these have long-term effects, particularly on the victim. I saw this, you see this firsthand, in my profession, and
Mm,
abnormal sexual behaviors
mm,
in a young child sometimes can
mm,
be a result of something like this. So we have
mm,
to be very, very careful. The other thing that I did, that as a result of my work on the task force, is that the number one cause of brain damage to children
mm.
under the age of 1 in the state of New Jersey is shaken baby syndrome. So
Yes.
I started program through my office. It's
Mhm,
called Knit One, Give One. So
mhm,
we used to call it colic when I was when I had children, and when you had children, and when our parents had children. But now they call it the period of purple crying. It's that it's it's a usually lasts from for birth until about 5 months. It's unrelated to anything. Children are unable to be consoled, and it's a way to teach the parents that it's okay. It's if a child is just cries and cries, to put the child in their in a safe place, maybe in a car seat next to you while you take a shower, for you to have a break. And what I did by Knit One Give One is that I solicited uh, people who I know. I'm an avid knitter myself, and I have donated hundreds and hundreds of purple
Wow.
caps to University Hospital. I again, initiative that I tried to get through was to require that every single mother who gave birth receive an in-service on prevention of shaken baby syndrome. And
Mm-hmm.
University Hospital postpartum does this for every single new mother. And we give them a purple cap as a reminder not to
Mm-hmm.
shake the baby. And people say to me, "Oh, I can't believe people do this." People are frustrated. People are tired. People don't realize that the damage they can be doing. This is
Yes.
an education program with a reminder. So my purple caps, again, I have a poster board. There was a church in Berkeley Heights that they regularly brought me hats. I go to a knitting group in Summit. They bring me purple caps. It has to be 50% purple. And to see somebody walking out of a hospital with a newborn, when I have
Yes.
visited a university hospital with a purple cap, I know they've gotten that education. And it's just so that we can prevent brain damage to children. And
Yes.
this is a simple way of providing education for those who
Mm-hmm.
may not realize what they're doing. So again, I'm very proud of that. I have lots of purple yarn. I have people have donated, and it's a good program. And University Hospital is the only public hospital in the state of New Jersey. I don't know if people realize that. Other
No, I
hospitals
think I saw that. That was amazing. Congratulations on that. That I think, in my opinion, is the most essential tool that we can give to new moms, first time moms. They have no idea what's going on. They are, especially in this day and age, they don't have mother-in-laws and mothers living around them or in the same towns to give them information or to guide them. And this is one way of saving lives and educating. And even parents might be just doing it not just out of frustration, but just out of love. They might be just, bouncing the kids in the
that's a
air or something like that, and
that's a
it could
good
be
point.
hurtful.
That's
It could be
that's a
hurtful.
very good point that people don't realize
No.
that that shaking that brain inside of that skull actually
Mhm.
can cause permanent damage. I think it's an excellent point that it may not be only in frustration, but it may be in, they think they're doing something funny. So good point.
Yeah. So if someone wanted to get involved with this, grandparents or parents or, empty nesters, and how would they join this cause?
That's an excellent question because I've been asked that by people that I've known as well, and it's not because every group has to they have to do background checks. If one of the women I know wanted to be a baby hugger, for babies who are in the NICU, etc. But you have to go through a process of
Yes.
being background checked and fingerprinted, and it's not as easy as you might think. But if you do want to do that, is I would say to reach out to the hospital, to reach out
Mhm.
to the department. The chief nursing officer is always a good place to start, through the office of his or her office, to see if they have such a program.
Mhm.
When we had a lot of HIV babies back in the day, we had a lot of babies who were in the hospital. That those programs were set up, but there's a lot of people who want to do that, but again, they have to be background checked. They have to be, which includes a fingerprinting. So I would start with like looking at your local hospital, and your
Mhm.
local facility, and asking go through the director of nursing and see what kind of program they have set up.
Mhm. Thank you so much, and I think a lot of viewers would love to be a part of that. So this is a great initiative, and I saw the flyer with all purple knitting and everything like that. I said, "Wow, this is super cool, attractive, and
Yeah.
resonates with a lot of new grandparents too."
Exactly.
Um,
And I don't have an office I won't have an office after January 12th to drop off, but I'm happy to set up a drop off location, some place that I could drop it off at my house. I don't mind sharing that, or I could figure out a safe place, maybe the police station, and I will continue to bring them to University Hospital. Again, the point I wanted to make about it being a public hospital is that many other hospitals have auxiliaries who raise money
Yes.
and who do a lot of things. And University Hospital has a unique population. And that
Mhm.
population, in many regards, the patients there don't get the same kind of things that they might get at a hospital that has an auxiliary. I live in Summit, and they raise money by the luminaries, and they do all they need baby blankets, et cetera, et cetera. So they have a community that is, like you said, very much oriented to doing that kind of work. University Hospital, because they have a unique population, and I'm not saying that those parents don't want to do the same, but many cases they don't. They're busy, making a living and raising children, and they just don't. There's just not as strong of an auxiliary there that we might find at other suburban hospitals. So I'm
Mhm.
happy to continue this program, and I'll figure out a way that I can have them dropped off and still that I would bring them to university.
Mhm.
I don't
We
think it's
can
a good idea
even.
to go to my house, but maybe we'll figure out how to bring him to the Summit Police Station, and I will work with the police chief, who I know quite well, and the mayor to collect them so that I can continue to do that. I
Mhm.
think it's a really good program, and I don't want to see it end.
No, no. I think this is beautiful. This cannot end. You just have to go on with it. And maybe who knows? You might be able to partner up with some local fire stations, police
Yes, good.
officers who would be
Yeah,
interested, wives of police officers, and then maybe some churches that we can
right. Oh,
have
good.
periodic drop boxes there.
No, I think it's an excellent
Definitely.
point. Yeah, I think I'm gonna. You know what? I'm glad I did this because I had not really given great thought to how I was going to follow up with that, but now I have some ideas. So thank you.
Yes, of course. Of course, that's what we do. We just brainstorm together.
Yes, right.
But so I had the privilege to meeting some of your friends, nurses at your birthday bash. Very interesting. And I was talking to them and, sharing information about some of the kids that are very interested in joining. There are a lot of them, they're becoming doctors and nurses. But at the same time, there's another pool of um, kids that we often overlook. And I just would love for you to give some kind of advice to kids who are interested in joining, like the ultrasound technician or sonography, or they want to become some technician. What message would you like to give to them?
I think that's an excellent point, Rosie, and I appreciate you bringing that up because healthcare is 20% of the US economy. And there are so many components of healthcare, as you point out. Being a physician is like time consuming and expensive and is, not for the faint of heart, let's put it that way. And many people, some the people who do it, go into it for the right reason, which I appreciate. And same with nurses. There are people who are afraid of let's say the body functions that they might have to deal with it, but still want to be involved in healthcare. So you're right. There's radiology technicians, ultrasonographers, and we are really in the state of New Jersey really pushing for people to go into these programs because we need these people in healthcare. The other group that I really want to advocate for that we don't hear enough about are PAs.
Mm,
We can I am a huge advocate for physician assistants. I think it's really critically important that
yes.
we have enough physician assistants because they are, again, like advanced practice nurses, trained in a particular area. I worked at Yale New Haven as far back as 1976 to 1979, and we were a burn designated burn center for
Mm,
overflow. There are two main burn centers in Connecticut were Danbury Hospital and Bridgeport Hospital. But when they were full, they came to Yale New Haven. And the two PAs who ran the burn program at Yale New Haven were two of the most remarkable people I ever met. And I have
mm,
seen this and I personally had a lumbar fracture myself and went to my orthopedic spine surgeon whose PA was outstanding. It's a way to be very much involved in healthcare
mm,
without the same number of years of training,
mhm,
but while at the same time having an unbelievable impact on the health delivery system. So we have physicians, we have PAs, we have nurse practitioners, we have nurses, we have nurse
medical assistants.
assistants, we have ultrasonographers, as you
Yes.
said, and many of these programs are. tech through the technology programs, and they're critical. Think about it. My son, who's in the trauma surgeon in training, he does an ultrasound like every night he's on call, and they have to get to the ultrasound, and they need an ultrasonographer. They also need an ultrasound machine that works, which is
Yes.
an issue for university hospitals sometimes. But they need those technicians. You can't get discharged sometimes without an ultrasound. And if we don't have an ultrasonographer to do it, you can't even get discharged, which delays your treatment. It delays your ability to be treated and released, or admitted and treated appropriately. So I think that's an excellent point, that healthcare, again, 20% of the GDP of the United States is healthcare. And we have many, many options there. Don't be turned off by thinking that like the sight of blood makes you queasy. You could do things in healthcare that don't involve blood at all, that don't involve, other things involved with, such as sonography and radiology, et cetera, et cetera.
Yes, yes, absolutely. Assemblywoman Munoz, I can talk to you for days. You just don't
I think
only
I can
inspire
talk for
me.
days, clearly.
We both are good at this, but I think it's not just me who looks up to you. The entire state of New Jersey looks up to you. It's not just people in legislature. I have known some of the senators, and I often talk to them. Senator Bucco, for example, Mike Testa, Kristen Curado, and then talking to Assemblywoman Michelle Matsikoudis, Ora Dunn. They all look up to you. That you have influenced everybody, not just them, but also locally, doing all the initiatives that you have done. And I want to take a moment to sincerely thank you.
Oh.
Your work has consistently reflected care, professionalism, and a deep respect for the people you serve. And it's clear that your leadership is not only recognized, but truly appreciated across communities.
Oh.
Your commitment to families, frontline workers, and communities that have seen consistency in your work, we all acknowledge and deeply value your work. You have built trust over time. That trust is one of the strongest indicators of a meaningful public service. Thank you for continuing to lead with purpose.
Well, I want to thank you. These last 2 weeks are difficult because I am stoic up to a point, but I found that saying goodbye is difficult. I don't intend to say goodbye, but I will say in my final statement is that this has been the privilege of my lifetime. It has been an honor of my lifetime. I feel that everything that I have done has been for others, not for anything to benefit myself. And
Right.
for that, I am grateful. I said to my children at the end of the day, I have to put my head on my pillow and wake up by myself. And I have to be proud of what I've done. And I can say that unequivocally. I will probably say this on the last day I'm in office, but on the day I was sworn in, I said that I was always proud to be the wife of Assemblyman Dr. Eric Munoz. And I think
Yes.
that he would agree that he would be proud to have been the husband of Assemblywoman Nancy Munoz. So I feel I am emotional about leaving because I feel that there's still work to be done.
Yes.
So I hope to have continue to have a voice somehow, some way, because
Mhm.
I think there's too much important work still to be done. So
Yes.
thank you for
Yes.
giving me this opportunity. Thank you for your kind words. And to the public who wants anything I can do to help, you can still reach out to me. We got to figure through instant. I'm Nancy. I think Nancy F. Munoz or Nancy Foster Munoz. I'm happy to have you reach out to me through Instagram or Facebook. My office is still in place until January 12th. I still have a staff there. You can still reach out. Just after January 12th, ASW Munoz at njledge.org goes away. So
Mhm.
figure out another way to keep in contact, though, because
Mhm.
I am not, I'm not, as I said when I went to Dunellen this morning to swear in the new council members, I said, I'm not leaving the state of New Jersey. I'm not leaving District 21. I'm not
Mhm.
I'm not leaving the profession of nursing. I am staying. I will continue to fight and to advocate for the people of the state of New Jersey. So thank you.
Mhm. Thank you. And we will continue to highlight all the work that Assemblywoman Nancy Munoz has done so far, and we will keep on following her throughout the next several years, and we will keep highlighting her work here on this platform as well for the Significantly Invisible and United for Impact, because we are all united in different causes to help out everyone. So no matter what she does and what email she wants to use next, I will always highlight. It'll be my pleasure to keep on requesting her and keep on bothering her to come to this podcast over and over and over again.
I'm happy to do
So
so.
thank you.
Thank
Thank
you.
you. Because constant conversations bring encouragement to people who are just listening and fearful, because there's a lot going on right now, even in schools. Parents are fearful that things that happen in school. It could be something that you touched upon with kids, so sexual abuse or something like that. Teachers and schools these days are saying that they're not obligated to share information that happens in school with parents, so that as parent it also freaks them out. So we have a lot of work to do. Parents are very worried that anything that happens behind school doors we will never be able to find out. We as parents are being left out with significant communications and conversations. It shouldn't be the case. So thank you all for listening to the Significantly Invisible podcast. Thank you,
Thank,
Assemblywoman Munoz.
thank you,
Today's
Rosie.
conversations remind us that the most meaningful leadership is often quiet, rooted in care, responsibility, and a deep respect for human dignity. Whether in healthcare, in policy, or at the kitchen table, these decisions shape lives long before they ever make headlines. Until next time, make care always lead and policy follow. I'm Rosie Takar. Thank you for being a part of this conversation. Thank you, Assemblywoman Nancy Munoz.
Thank you, Rosie. You were great. Thank you.
Thank you.
Thank you.